Well, hello to everybody that has made it here, including myself. Live streaming on YouTube has some technical issues, which kept me from being on time. I'm 5 minutes late. I'm sorry about that, but I do appreciate everybody that has made an effort to be here today for this live stream and who's patient and putting up with my tardiness. I hope y'all can hear me okay. Um, the topic for today's live stream, I think you're going to find very interesting because I thought it was important to not recover the things that we frequently talk about, but to try and add something new, something that maybe you haven't considered before, and maybe that will spark your interest. I'm hopeful that it will. Um, anyway, I think Heather is with us in the chat and will be mediating questions you all have. And so I want to encourage you to ask these questions. And if she needs to include my opinion in the answer, she will certainly do so. But even if I'm talking, you can ask a question, you can get an answer. And I think that makes this a really useful format. So as you know, the pelvic floor solution and our program called the Pilates method, Pilates, has been around for a while now. We have trained thousands and thousands of instructors and helped tens of thousands of men and women regain and maintain bladder control, and really by emphasizing natural solutions like pelvic floor fitness training. But it's not just regular pelvic floor fitness training, it's pelvic floor fitness training with movement in a way that leverages something called a plyometric effect. And that seems to be the secret sauce and why people get better so quickly with this method. It's really remarkable that 80% of our participants are at least 50% improved in 28 days of training. Hard to imagine. It's faster than a drug for overactive bladder would work. It's faster than a surgeon could get you into the operating room to address stress incontinence. So it's a pretty good deal. And you don't have to go to the operating room or the pharmacy. And I really believe in my heart that we can help the majority of people with bladder control problems avoid these things. Sometimes they are necessary, but you should be given the opportunity to participate in a program that is likely, that is probably going to help you avoid these things. And so, with respect to stress urinary incontinence, which most of you probably already know is leakage of urine with coughing, sneezing, and laughing, that sort of thing, we often talk about strength and speed of the pelvic floor as the critical ingredients for continence. And because the pelvic floor is the last fitness issue, and most people don't even know they have a pelvic floor, much less how to properly train it, pelvic floor weakness is incredibly common. It's incredibly common and reversible. Good news. Even if you're in your 80s, you can reverse it and restore and maintain bladder control. And that's a pretty good deal. You see, when you cough, sneeze, laugh, run, or jump, your nervous system is busy. In fact, your nervous system sends a reflex signal to the pelvic floor muscles and to the small portions of the pelvic floor muscle that surround the urethra, that create the urethral sphincter, and they cause that urethra to contract even tighter than it already is when you're not running, jumping, coughing, sneezing, or laughing. It causes a reflex contraction that is very brief, but it is at just the right moment. And as a consequence of that, when the pressure inside the bladder increases because you sneezed, say, the urethra is already closed tight, 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 and keeps the pressure in the urethra above the pressure in the bladder. And that's the nature of stress continence. What's interesting is if you cough or sneeze, the reflex to the urethra actually happens before the cough or sneeze happens. That's the way you're wired, so that you can get that urethral pressure up above the bladder pressure and maintain continence. If it came right at the same time as that pressure wave hit the top of the bladder, then you would leak urine because the urethra wouldn't have enough time to mount a contraction. It takes a few milliseconds for the urethra to actually clamp down. So it has to get there first. It is called an anticipatory contraction, and it relies on an intact somatic nervous system. And that means somatic means the nerves that go to the muscles you have voluntary control over, like your arms and legs, most of the time, hopefully. And so that system, for that reflex to work, that system has to be intact. And unfortunately, sometimes, especially during vaginal childbirth, those nerves that are going from the spinal cord to the pelvic floor muscles and the tiny muscles around the urethra get damaged. They get injured. And although they do heal in a remarkable way and to a remarkable degree, they never quite heal as well as they were before the trauma took place. That's can be a problem. That can be a problem. Why? Well, when muscle tissue, be it the urethral sphincter or the pelvic floor, loses nerve supply for any amount of time, it begins to atrophy, meaning the protein in those muscle cells gets repurposed by the body, taken elsewhere, and the muscle gets weaker, right? Use it or lose it. You don't use a muscle, you're going to lose it. And so, even once the peripheral nervous system heals from a trauma like vaginal childbirth, the innervation isn't as robust or complete as it was before the trauma took place. And so it takes a bit of overcompensation to get back to where you were, which means additional effort. And with age, the nervous system doesn't fare very well. Nothing does, right? Everything gets worse as you get older, except your sense of humor, which you better have because you're going to need it. The nervous system, especially parts of the autonomic nervous system, degenerate to an alarming degree. And when that happens to the somatic nervous system, it tends to further degrade the function of those nerves that allow that reflex response to occur and stress continence to be maintained. So age is not good. So one, you have to compensate if you've had vaginal childbirth, and two, you have to try harder as you get older because your nervous system is deteriorating. Sorry for the bad news, but better you know it, better you know the truth, and then you can make some conscious decisions about how you're going to deal with it so that you can maintain continence. It may sound like perhaps not the most important thing in the world, but let me tell you, it's the number one factor relating to the decision to put a woman in a nursing home, whether she can control her bowel and bladder. It's a big deal. It has everything to do with maintaining dignity and independence during the last years or decade of your life. And like, what's that worth? What's your independence worth? That's why this really matters. And we have spent the last 15 years shouting from the rooftops every opportunity we've gotten, talking to people about this issue so that they have access to, whether they choose to use it or not, they've been given the opportunity to do something about it. And that's how the pelvic floor affects stress continence, and why it matters. But you know what's even more interesting and that I have gotten really on fire about lately is the other continence mechanism that makes up a huge portion of men and women with bladder control problems, and that's overactive bladder, because it is so profound and so helpful to understand the way the somatic nerves, like we've been talking about, the pelvic floor, interact with the nerves that control the bladder, which are not somatic nerves. They're autonomic nerves. And your autonomic nervous system is like the stepchild of the nervous system. People, maybe they've heard the term before, they've heard the term sympathetic, parasympathetic, but they don't really know how this parallel system of your peripheral nervous system works. So the somatic nerves control your arms and legs, help you move around. And your autonomic nervous system maintains the function of all of your organs. Think heart rate, blood pressure, gut function, liver function, bladder function, sexual function. That's a lot of functions. How often you take a breath, right? That's all autonomic. And you don't have to think about it, fortunately. And the reason you don't have to think about it is because the autonomic nervous system has two portions, sympathetic and parasympathetic. And in general, they do opposite functions. So when the sympathetic nervous system is more active, the parasympathetic nervous system is relatively less active, and vice versa. So they can balance each other. And the importance of maintaining autonomic balance is really what we're going to talk about today. So let's get into that a little bit, because this topic has not gotten anywhere near the attention it deserves. The idea that I'm trying to convey is to start thinking about neurologic fitness, not just physical fitness as sort of a general term, but the fitness of your nervous system, and specifically, critically, the fitness of the autonomic nervous system, because it gets out of balance as we get older. And it seems, of course, both arms of the autonomic nervous system, sympathetic and parasympathetic, degenerate, but they don't seem to degenerate at the same speed. It seems like the sympathetic components of our autonomic nervous system degenerate a little bit faster, putting everyone into autonomic imbalance as they get older. And pretty soon, people end up with blood pressure problems and cardiac arrhythmia or heart rate problems, gut problems, constipation, diarrhea, bladder problems, overactive bladder, loss of sexual desire, impotence. All of these things are the consequence of an autonomic nervous system that is out of balance. Well, that's pretty interesting, right? If we understand the why and the how, why can't we do something about it? And you can do something about it. And this is really what's so exciting. In terms of how to approach, as a urogynecologist, autonomic imbalance in the form of overactive bladder, pelvic floor exercise is a great solution, because every time the pelvic floor contracts, those muscles and the nerves that go to those muscles send a signal back up to the spinal cord, where that signal interacts with autonomic fibers that go to the bladder. There is a reflex loop at the level of the spinal cord, and there's actually a second one in the brainstem that also modulates or adjusts the tone of the autonomic nervous system. And so the effect of pelvic floor exercise is to quiet down the portion of the autonomic nervous system that makes the bladder contract. And that is the parasympathetic portion. It comes from S2, 3, and 4. And the nerves that go to the pelvic floor come from S2, 3, and 4. And they interact, somatic to autonomic, to restore bladder control by inhibiting the bladder from contracting when you don't want it to. Okay, we've covered that. This is basic Pilates stuff. And the instructors in the audience will say, yeah, I've heard it a million times. Hopefully they remember, because this is such a key component of what we do, right? We're modulating the autonomic nervous system using somatic exercise, and this can be applied to many different organ systems. It's just that we talk about the bladder a lot. But it certainly applies to sexual function, bowel control, certainly applies to gut function, cardiac function, all these things. But we apply this to bladder control. But what else affects and influences the health of the autonomic nervous system? Now, I have gotten deep inside Introduction to Clinical Aspects of the Autonomic Nervous System, Volume 2. And I have volume 1 also. And so I've just been nerding out on this lately, trying to create a more unified understanding of how we can protect and recover our autonomic nervous system, so as to go beyond just do your Pilates exercises, which is important. You should do them. But we can get beyond that. We can get farther than that by protecting the autonomic nervous system. Now, there's a number of things that are endogenous within us that threaten the autonomic nervous system. And there are a number of things that are exogenous, meaning outside of us, that threaten the autonomic nervous system. For instance, consuming alcohol is neurotoxic. We know that's true. And autonomic dysfunction is a consequence of chronic long-term alcohol abuse. And there's interesting data published recently about any amount of alcohol consumed contributing a greater risk of dementia in a later adult life. And that's really alarming and concerning because it's so readily available, especially this time of year, right? We often would choose to imbibe in spirits that actually are just really toxic, especially to the nervous system and specifically to the autonomic nervous system. So number one would be to moderate or eliminate alcohol altogether. Another factor has to do with sort of general nutrition, specifically consumption of processed foods that are kind of low in nutritional value, but high in sort of chemical toxin value that create a greater degree of inflammation in the body. And I don't like it when people casually throw around words like inflammation. Like, oh, what exactly do you mean when you say, I've had a lot of inflammation? Or, right, like that has to actually mean something. And it probably, because it's become such a vernacular phrase, it probably means different things to different people. So let's define it for when we were talking about it. And what we're talking about is a state of oxidative stress. Oxidative stress. So when like your body's like a furnace, right? And for the furnace to function, it has to burn fuel. And the fuel are the things we consume, right? The foodstuffs that we consume that get broken down and absorbed in the gut, taken to the liver, and then distributed throughout the body as glucose and amino acids and fatty acids that our body uses in different proportions for fuel. And what do you do with fuel? Well, you burn fuel, right? In a furnace, you use a flame to burn fuel, but we use structures inside ourselves called mitochondria. And there's a couple of different oxidative processes that can take place in the mitochondria. The most efficient has to do with the TCA cycle. But there are other ways of using fuel inside a cells and mitochondria that are less efficient. The long and the short of it is, though, that in burning these fuels, free radical molecules are created. And these free radicals are very damaging to your cells. They are a byproduct, a waste product of oxidation that you have to do to make energy, right? You run out of ATP, you're a dead duck. You got to keep making ATP your whole life, right? And so that oxidative stress means you've got more of these radical oxygen species that are likely to damage DNA in particular, but other things too. You have more of those than you have antioxidant molecules that actually have a job of gobbling up and clearing these toxic free radical molecules. And they specifically things like really good quality olive oil that's high phenolic is a really good natural source of potent antioxidants, and it tastes good too. So that's a good thing. Like if you don't if invest in a really high quality oil to cook with and consume, then you're really missing out, because the sort of bargain brand olive oils I spent most of my life consuming just aren't even the same product as these really high quality, high phenolic olive oils. You can find them on Amazon or probably in Whole Foods. Um, I'm not sure about more affordable stores like when I go to Rayleigh's here in Nevada, or Fry's when I'm in Arizona. There are some that are better than others, but they don't really have a wide variety. Anyway, they're good for you and you should use them because it would help you maintain a level of antioxidants that will help gobble up free radicals and prevent damage to the DNA of every part of your body, but especially the nervous system, and within the nervous system, especially the most ancient part of our nervous system, which is the autonomic nervous system. So if you go back 500 million years and you look at organisms that were developing from that primordial ooze you've heard about, right? The first sort of prototype nervous system that they had was this thing that's kind of referred to as the ventral vagal system, which was basically just parasympathetic, right? It was just parasympathetic. And then after a while, the sympathetic nervous system evolved to create this fight or flight response. And then ultimately, this dorsal vagal system evolved, which kind of incorporated both the parasympathetic and sympathetic. But, this thing has been evolving over 500 million years, right? Longer, much, much longer than human beings have been around. And it is vulnerable to age, and whether you have the healthiest diet free of free radicals or not, it's still going to deteriorate. But we need to do everything we can to modify the risk factors that we can modify. And so making sure that we're not creating excessive oxidative stress by being careless with what we consume is one thing we can do. And I think, reducing alcohol consumption, making sure that we're not eating too much processed food, and making sure that among the proteins and vegetables that we do consume, we're getting adequate quantity of free radical consumers, right? Those antioxidants. Resveratrol is another one. Ironically, it's in red wine, but it's in a bunch of other things too. You can get resveratrol without eating red wine, or drinking red wine, I should say. But it's another real potent antioxidant. And so that's something to think about. But what about emotional stress? We know that emotional stress and mental state affects the autonomic nervous system, and that there's a positive feedback loop from the autonomic nervous system back to our emotional state. And so chronic stress, when we use this kind of stress in our language, we're not talking about oxidative stress. We're talking about psychic stress. It's every bit as real. And it's every bit as deleterious to the autonomic nervous system because it tends to create a disproportionate sympathetic load versus parasympathetic. So you end up sympathetic dominant. And that probably is less likely to cause the pelvic floor problems like overactive bladder. But if you're the opposite, depressed state, really parasympathetic dominant, it's more likely that the parasympathetic effect of the autonomic nervous system on the bladder will be revealed as overactive bladder. And so mental state feeds back on the autonomic nervous system, which then feeds forward to the autonomic nervous system. I just did a video on how having stress incontinence after vaginal childbirth increases the risk of postpartum depression by like 30%, 30, 40%, something like that. And so that's an example, right, of how in this case, bladder function and the social consequences and personal consequences of being incontinent can feed back and affect a mental state, which clearly is a function or has an influence on the autonomic nervous system as well. And so that's important. High intensity interval training is probably a good way to cycle the autonomic nervous system and maintain balance. We don't talk enough about it, and we don't do Pilates that way. But in terms of a long-term anti-aging strategy, keeping the autonomic nervous system responsive and nimble is probably really important as well. And so stay tuned for a more coherent list of things to do to maintain and improve the health and responsiveness of the autonomic nervous system, because it's important for pelvic floor disorders, but it's important for everything else also. So who knew, right? Who knew? All right. Boy, you guys have been putting up with me for a while now. I'm going to start to wrap things up here, and thank you all for your attention and being here with us on this Wednesday evening. I hope you all had just a great day today. I hope you'll join us on future live streams. If there is something you would like us to talk about and address specifically, something that's important to you, we'd be happy to do it. If there's a case history that you'd like to hear us present, let us know. We'd be happy to do it. If you have experience with our method, let us know. How's your experience been? We really appreciate the feedback and the fact that our social media presence affords us the ability to connect with all of you. And so whether you're on the live stream with us or watching this later as a recorded video on YouTube, please interact with us. Like the video, subscribe to the channel. That's all you got to do. And we will keep information coming to you. I thank you all very much. I thank you, Heather, for being here as well. I hope this was interesting. And we will be back with you soon.